I couldn't help but think, she's gonna die. She's gonna die. She's either gonna die in her sleep, she's gonna die while I'm feeding her, and it's gonna be my fault. I'm Kyra Reed. I'm dually trained in emergency medicine and pediatrics, and I work currently in the emergency departments here downtown. I am also an assistant program director for the emergency medicine residency, and I've had that position for the last 5 years. So after working as a faculty for a couple of years, I had gotten my feet wet clinically. I started to feel kind of comfortable. I became pregnant and gave birth to my first baby at the end of 2019. And up until that point, I felt pretty comfortable with the idea of becoming a parent. I thought, I'm trained in emergency medicine pediatrics. I've got this on lock. I know what I need to know, and I feel like I can handle any situation, or at least recognize when I need help. I had, unfortunately, kind of a traumatic birth experience. We were both okay, which is great. But I remember being wheeled out to the car, and I had this tiny little infant in my arms as they're wheeling me through the hospital. I felt in a haze and very disconnected. I wasn't having anxiety at that point, but I just felt like something was off, and I couldn't put my finger on it. We put the baby in the car, I get in the car, the door's shut, and there's silence, and I realize it's just us now. I'm in charge of this tiny human's life. On our drive home, and I started to think about all the scenarios that maybe I didn't know or wasn't prepared for, or what I could miss, and I felt very responsible for knowing everything about everything. And with my training especially, I felt like there was an overwhelming responsibility to know and to anticipate. That anxiety started to build, and I pushed it down as much as I could because I was just thinking, you've done hard things before, you can do this. You can get through this, you've done hard things. And you could do it alone. I never thought at that point to reach out for help. I just quelled it, move on. That's what I always do. A few weeks into being home, it was clear she was having some difficulty feeding. She would gasp or choke during feeds and then stop breathing and turn blue. She got admitted once for that. The issues persisted and got worse. Over the course of a month, it was every feed. She was gasping, stop breathing, turning blue, going limp. Every feed, every 3 hours. One day, she just didn't recover breathing. But this wasn't during a feed, she was just in her carrier. I noticed she looked a bit pale. Then I noticed she was gray, not breathing, almost black around the mouth. I immediately started to resuscitate her at home. Despite all my training, I never felt so unprepared to be doing that at home. We got her to the ER, and all my colleagues are there taking care of my baby, and I just felt in such a different place. I had never been in this place before where I was a mother of a child who was so sick, and I didn't know what was going on. I had no idea. They took great care of her. She got admitted. We were in the hospital for many days. She had a full workup. Everything seemed fine, and we didn't have any answers as to why this had happened. And she recovered and was doing well enough to go home, but I just felt like I had no idea what had happened, and what if it happens again at home? I couldn't help but think, she's gonna die. She's gonna die. She's either gonna die in her sleep, she's gonna die while I'm feeding her, and it's gonna be my fault. I don't have an answer and I can't prevent it. It was to the point where only myself or my husband would feed the baby, because if you just relaxed your attention for 1 second, she would do this, where she would stop breathing, turn blue, go limp. And this would happen at 2 a.m. I'd find myself sobbing. I can't even feed my baby. How am I supposed to do this? I can't even feed her. I came back from maternity leave January 1st, 2020. So my first day back to my job and the first day of a new position as assistant program director for the EM residency. At my job, seeing death, particularly with kids, was distressful on a whole new level that I hadn't experienced before. Having going through what I was going through with my child as well, I kept transposing images of my daughter on those children, and then at home, those children on my daughter. And it was just very difficult to do my job. And as you all know, around March, what happened in 2020 was COVID. And here I am working in the emergency department during COVID, where we had no idea how lethal it was, how contagious it was. We were hearing all different things all the time. I was extremely worried about bringing something home to my daughter that would end up causing her to be ill or to die. And on top of that, my child was still having those issues with feeding, and it was just a lot. And that's what all was happening around that moment that culminated in that decision to end my life. And so one afternoon, I was sitting there feeding her. She did it again. I stood up. I put her in a safe place. My husband was in the kitchen, and I said, I need a break. I'll be back in a minute. In that moment, as I was looking at her, I just had decided that I no longer wanted to live. And it's not like I had been thinking about it. I just knew that that was the solution to my problem. I couldn't bear witness to her dying and it being my fault. Because that's how I felt. I felt like it was my fault in the moment. I felt like a failure. Everything I'd worked for to care for others, I couldn't even care for my own baby. I took my husband's firearm and I grabbed a piece of paper. My plan was to drive around in a rural area near our home, find somewhere pretty to look at. And so I drove, and this spot wasn't good enough, and that's too close to the road. I needed to make sure that I wasn't found too quickly, but quickly enough that my family wasn't in distress for too long. Drove. I'd been on the road for hours, looking for this ideal spot to stop and write my final note. I ended up at a dead end in the road, and it was a dead end into a person's driveway. And there was a house sitting there. And on the front porch was a man just, looking at the evening sunset. And then I realized that, whoa, this is the end of the road. There's a person sitting there looking at me. He stood up and he just had this look on his face like, what are you doing here? What are you doing? Not in a mean way, just confused why anyone would be out in the middle of nowhere stopping in his driveway. And it just dawned on me what I was about to do, what I had nearly done, what I had set out to do. And I said to myself, what am I doing here? Oh my gosh, what am I doing here? What am I doing? And I backed up, turned around, I started sobbing. I called my sister, told her what had just happened. She said, get home, tell me where you are. And I drove home. I got home, I walked in. My husband said, you feeling okay? You were gone for a while. Went up to the bedroom, put the firearm back. But what I had realized was that I had no idea how it was placed before I picked it up. I knew that if I didn't put it exactly back the way that he had it, he would know. And I realized that I had no intention of coming back because otherwise I would have noticed how it was sitting there. And so I set it down and I realized I would have to tell him because he would ask me why it was moved. So I went downstairs and said, I have something to tell you. And when I told him, he was, obviously distraught. And he said, you have to call for help right now. I was reluctant, but I knew I had no legs to stand on when it came to what I need to do next. I was just gonna do whatever he said to check the box. I knew I had no excuses not to. But instead of trying to figure out who to call, I instead thought, I need to make sure that I'm not gonna get fired over this. Before I seek help in this moment, I need to see if my job is safe. And that made me so angry. I was so angry about that I almost couldn't even make the call because in this moment of crisis where I needed help, my first call was gonna be about my employment. And I felt that was so backwards in the moment, especially working so long in healthcare and giving up, a lot. I love my job and I'm grateful and honored to be in this profession, but it just felt so backwards that this was the order of events that I was having to take. So I called a mentor and one of my bosses at the time, and I said, theoretically, if I ever need to seek help for postpartum depression, would I have to disclose that? And they said, you'd have to disclose it. And they did ask me if I was okay, and I, of course, said yes. But I was just so angry that I had to make that phone call and ask. And then I was more angry that I had to disclose it. For why? For why? Just getting the help that I need. And then I had no idea how to go about finding help. So I just Googled postpartum depression, IU Health. Clicked on the webpage, there was a phone number to call, so I called that number. She did a screening for me that did my anxiety and depression scores. And that was the first time I'd ever been assessed for this. I had no idea what the scores meant, but she told me my scores are so high that I recommend you be seen as soon as possible, potentially go to the emergency department now. And I said, absolutely not. It's not what I'm gonna do. And so she got me into a therapist within 24 hours, and she recommended that I go to peer support groups for postpartum depression. I wasn't really bought into the fact that this was gonna help me. I didn't think anyone was gonna understand my situation. I thought no one's gonna tell me anything that I didn't already know. I felt like I was just checking boxes, so I said okay, but I was not looking forward to it. I was actually kind of annoyed that that would be something that I was gonna have to sit through. So I started going to the peer support. I was very quiet for the first several weeks. I just sat and listened with my screen off and didn't really participate, because I just truly didn't think anyone was gonna say anything helpful. And I had it all wrong. I had it all wrong. As I sat and listened, what they were describing was exactly what I was going through. Whether they were physicians or not, like, this was a ubiquitous feeling. And I was afraid to talk about it. I was afraid as a physician I'd be judged. Maybe they would find out my name and would think I wasn't competent at my job. So I was worried to get still about my job and about feeling incompetent. And as time went on, I started to realize that they could relate to me, and I started to share. And I found that what I had shared was helpful to others, and that gave me so much hope and fulfillment from it being like a reciprocal sort of process. Here I was thinking I was going into it, what am I gonna get out of it? What's in it for me? And that was just the wrong way to think about it. Although I did get something out of it, it felt good to help others and to know that what I was saying, what they were saying was helpful. And we got through it together. And so I became a proponent of peer support. And then in terms of therapy, it was immensely helpful. And something that I'm truly grateful that I was able to participate in. In emergency medicine, we talk about being the safety net for others and for society. And that was my mission for so long, was advocacy for a population, which is still very much a part of what drives me to do emergency medicine and pediatrics, is take care of vulnerable populations. But we don't care for each other the way that we should. We need to be a safety net for our colleagues and stop stigmatizing mental health needs as a weakness, because it keeps people from getting help. We lose a physician every day to suicide. And it's just not okay. It's not okay. It's time to stop ignoring it and really embracing how important it is to support and be there for each other. And that's my mission. That's my mission, is to do whatever I can, really, from what I can control, which is the residency curriculum, and then kind of work from there systemically. How can we keep advancing these things? And it's gonna take time, and it's gonna take a lot of effort. And so I created a training curriculum, and it's been, per our residents, one of the most impactful wellness initiatives that we've done. It makes going through what I went through worth it. To feel like potentially that, even if it's one person, even if it helps one person from making that choice to end their life, if it helps one, then that's good enough for me, And I can be a better mother, having already done this work. I can teach her these concepts early on, that she's enough, she's not a burden. Her worth isn't determined by what she achieves. All those things that I'm learning late in life. But at least, late's better than never. So I feel grateful that I had the second chance, that I didn't go through with it, that something, whatever it was, kept me here. So I'm just grateful.